Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Dr. Jennifer Mensik Kennedy, who is the president of the American Nurses Association, about why your workforce strategies aren't working. So, hi, Jennifer, how are you?
Hi, very good. Thank you for having me.
Of course, thank you for taking the time.
Mhm.
So let's jump right in. What do you think are the top three biggest workforce growth issues in the nursing industry?
Absolutely. We've surveyed nurses, and from our most recent survey, nurses are really concerned about inadequate staffing, inadequate compensation,
Mhm.
and well-being work environment, which is, I think, really three really large things to undertake. But we really do need to focus on those three,
Mhm.
particularly if we want to change the future for nurses and with the younger generations coming in. I was at the National Student Nurses Association conference this week, and that was a
Mhm.
big thing on everyone's mind, wanting to know what we are doing about that.
Absolutely. So, what do you think are some common strategies that aren't working to tackle these issues?
Oh, common strategies that aren't working. So
Mhm.
I think, first one, I think there's that quote that says, "The more we change, the more we stay the same."
Mhm.
And so, having been around for almost 3 decades now, I see that we continue to bring back the same thing. So, for instance, people talk about new and innovative care delivery models, but when
Mhm.
you listen to what they're actually doing, it's really bringing back care delivery models that we've had in the past, and it's might be new to them, but it's not innovative. And
Mhm.
so, I think we need to really think outside of the box and look at what all the possibilities are. And we do need to modernize our care delivery models. We need to look at how we, fold in nursing practice with virtual care, with remote care, and
Mhm.
really understand how we can provide nursing practice. So it's about, okay, there's team nursing and there's primary nursing, but those are models of the past. And so, how do we really truly be innovative with different types of practice, bringing in advanced
Mhm.
practice nurses, clinicals, nurse leaders, CNSs into the care delivery model, and not just LPNs, but also looking at the full scope of all nurses.
Absolutely. And so, what do you think are some of the strategies that are effective, and how can nurse leaders and CNOs take steps to pivot to those strategies?
Absolutely. I think a couple things that are some really good strategies include, looking at flexible practices
Mhm.
that kind of allow nurses to, it helps support staffing, but it also helps support well-being. And so, an example of that that I learned about, and as well as an example that I heard about during COVID, were
Mhm.
that for nurses in high stressed areas, for instance, like the ICU, the nurses wanted to, they love being ICUs, but they also wanted to take a break a little bit and
Mhm.
to go to another unit or go somewhere that might not be um, as stressful. And so there are hospitals that during COVID said, if you worked 2 days a week in ICU, one day we'll put you in the PACU or we'll put you somewhere else so that they could rotate. And
Mm.
some of those hospitals have continued to do that same practice today. And when I hear from nurses who said they left to be travelers, they asked to do those same flexible practices, but were
Mhm.
told that the organization wasn't going to do that. So nurses took that in their own hands to determine their own flexibility. And so, if we really want to look at how do we retain nurses, we need to be able to provide those flexible practices because nurses
Mhm.
have a lot of options to go do a lot of things. And to be able to say we can't be flexible in how we provide care or how we orient or educate nurses, we really need to look at what the new model of nursing is and be able to support nurses who want to be able to be flexible like that.
Absolutely. And you mentioned retention. How can CNOs create opportunities for their workforce specifically to help retain them?
Absolutely. I think mentorship is
Mhm.
really big. And so we did the American Nurses Foundation did a generational survey,
Mhm.
and we found that mentorship is mutually beneficial.
Mhm.
That 80% of early tenured nurses reported mid tenure and most tenured nurses were great resources to learn from. And in a situation where we have so many newer grads and younger nurses on the floor as the older nurses leave. We need to do look at how we retain those long tenured nurses to be those
Mhm.
resources, and how do we change those positions so that we utilize the knowledge that those mid tenure and most tenure nurses have. And what we found too is that 75% of those mid tenure and most tenure nurses really enjoy working with their less experienced peers. So we need to
Mhm.
provide opportunities, and oftentimes when we're short staffed,
Mhm.
or we're just focused in on hours per patient day, we don't build in that slack, for lack of a
Mhm.
better word,
Mhm.
that allows people to talk to each other and to learn from each other. And so that we need to stop thinking of it as non-productive time and really think about how productive this mentorship is to really
Mhm.
keep nurses in the workplace.
Absolutely. And so, how would you create that time within the daily shifts of a nurse for them to be able to communicate with each other like that?
No, I think that's a great question, and this goes back to looking at and this is tough. We know there's a
Mhm.
lot of the work environment. So we have nurses who leave because of the work environment, and first and foremost, we're going to have to deal with that. We're
Mhm.
going to have to, take care of and manage workplace violence. We're going to
Mhm.
have to look at the flexibility. We're going to look at the staffing components and look at how many patients people do get, and look at the shared governance and are we listening to nurses? And so when we look at that environment and we provide an environment that's healthy and it helps promote good patient care, you're going to have those nurses staying. And so that's like
Mhm.
really first and foremost, is to help manage that work environment and make it really strong. And then you're going to have the older nurses or the more tenured nurses, sorry, because a younger nurse could be very well tenured.
Mhm.
Um, who is going to stay and then work with those lesser experienced nurses. So, within all of that, this is a good opportunity for shared governance,
Mhm.
and bringing in both groups. To have have conversations about what is staffing, what are best policies and practices, what's EBP, what are those research projects, and every time you have an opportunity to do that, that's a great opportunity to get those nurses together to
Mhm.
have those conversations, and even partnering individuals too, day to day in their work related to mentorship and who do they have, especially on night shift. I think oftentimes we also don't think about night shift in these terms. We have a lot of
Mhm.
newer graduates or newer nurses on night shift, and what are those resources to keep our experienced nurses on night shift or to provide some type of mentorship. And oftentimes this goes back to virtual nursing,
Mhm.
or those EICU concepts, electronic ICU, electronic med surge concepts, where a less experienced nurse has that person they can reach out. May not be in person, it could be virtual, and that's just as beneficial.
Absolutely. And I want to touch on that virtual nursing piece for just a second.
Mhm.
What role do you think technology and virtual nursing plays in workforce development?
Absolutely. I think it's vital that we incorporate this. And the
Mhm.
American Nurses Association released a position statement on AI to ensure
Wow.
that nurses are adhering to the highest ethical guidelines and following a set of standards to ensure safety, consistency, quality of care, and enhanced patient care experience. And
Mhm.
our code of ethics also speaks to this because we need to make sure that when we develop this technology, the policies and procedures, that it's clear that it's not a replacement for a nurse's knowledge and skill. And
Mhm.
oftentimes, I think that gets lost. And we need to make sure that nurses know that the AI, the technology, doesn't hold the license.
Mhm.
It's how are they utilize the clinical to support structures that they have and that AI, and then using their license and their judgment and their skills then to take it all in together like evidence-based practice
Mhm.
and make the right decisions, because at the end of the day, people want to be cared for.
Mhm.
And they want that human touch, that human experience. And so it's vital that we have nurses who are able to be there providing
Mhm.
that caring component for those patients.
Absolutely. I've heard it phrased as virtual nursing is used in tandem with nurses rather than as a
Absolutely.
replacement for nurses. Yeah. So you mentioned a little bit about creating healthy work environments for nurses. So, what do you think has to change culturally within health systems in order to better recruit and retain nurses?
Well, we'll talk about workplace violence. And what
Hmm.
I hear from nurses is, and there's two bills federally out there related to workplace violence,
Hmm.
but newer nurses are scared. I have, emergency room nurses that are scared, who are, want, leave the emergency room. We have nurses in home health that are afraid. And
Hmm.
so a couple things, we do need to own, the organizations need to own, how are we keeping nurses safe? And what I
Hmm.
hear from nurses is, well, it has become such a common occurrence. People don't really
Hmm.
think twice about it. They may not file a report in their organization. They may not even know how to file a report in the organization. And then, worse, in some situations, the nurses are treated as though, hey, what could you have done differently to not get
Hmm.
hit or to
Yeah.
not, and that's tough because my husband was an ICU nurse, doing direct patient care, and he was tackled in,
Oh, wow.
in a corner. And so I think, and so he's not been able to go back to direct patient care because of that injury. So
Hmm.
we do need to look at safety. We do need to look at how much it is occurring in each of our organizations and ensure that we have structures in place that monitor for it, allow nurses to know that they can report it,
Hmm.
without feeling guilty for reporting it, and that the organization is actually doing something about that. So, what are we doing to prevent it? It's one thing to say, oh, we can
Hmm.
charge, and we can report to the police, but how can we prevent someone from getting hurt? And I really want the organizations to be able to dive into that. And I would hope that we would have CEOs on board with this, hospital board of directors on board. And part of this is being one of those key, KPIs,
Hmm.
key performance index indicators that they're looking at about the amount of violence that's occurring to their employees. So if we really want to do something about it, this has to be integrated into every aspect. And so the ANA specifically supports the Workplace Violence Prevention for Healthcare and Social Service Workers Act. And this is specific around working with OSHA and having OSHA mandate and come out with wording and requirements for healthcare organizations.
Hmm.
So, and there is a version too in the Senate called the Safety for Violence. Um, let's see, Safety for Violence for Healthcare Employees, the SAVE Act. And it
Gotcha.
would actually create federal legal penalties for individuals who knowingly and intentionally assault and intimidate hospital workers. So this
Hmm.
is a multi-pronged approach. And so there's, the regulatory perspective out there, but, healthcare organizations can take care of this now and to do this now. And if people feel safe, they're not going to think twice about, leaving if they feel like the organization is providing the safe place for them to work.
Absolutely, yeah. And speaking of CEO involvement, we've kind of talked about mentorship and virtual nursing and workplace violence prevention. So, what are some tips that you might have for CNOs for advocating for these strategies to be implemented by the C suite?
Absolutely. And I think this is tough because CNOs and nurse leaders and managers have some of the hardest jobs. They're
Hmm.
in between, really wanting to take care of their staff and doing what's right, and then working within their C suite and with their CNOs or
Hmm.
CEOs related to this. And what I would hope is that it's more than just the CEO that the CNO would work with. I would
Hmm.
hope that hospital boards are asking for the CNO to report out at the board meetings. I would
Hmm.
hope that the CEO is in support of the CNO reporting out at board meetings and having that voice for nursing, which is, it's the largest workforce in a healthcare organization,
Hmm.
speaking to these exact issues and talking about what they're doing to ensure a healthy work environment and a safe work environment, and hoping that the CEO and the board do what they need to do to support that CNO in requiring it. So we really need to while I know CNOs advocate it really needs to start with the CEO and the boards really saying, you know what, I want to listen to the CNO and I want the CNO to report out. And so let's start there, because the CNOs are trying to advocate, and sometimes the CEOs and the boards just don't want to listen.
Absolutely. Yeah. Well, thank you so much, Jennifer, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening.
Thank you.